Lung cancer is the leading cause of cancer-related deaths in the United States. And now St. Peter's University Hospital has become the first hospital in Middlesex County to offer low-dose CT screening for the detection and treatment of lung cancer. Now, joining us this morning is Dr. Douglas Frenia from St. Peter's University, who has more on the screening. And first of all, Doctor, thanks so much for coming into the morning edition and speaking to us.
You're welcome.
And I guess, for people at home, what is low-dose CT screening? And why should people consider it?
Well, low-dose CT screening is a type of imaging that will help us to detect lung cancer. And because lung cancer is the leading cause of cancer death in the United States, it has been researched whether or not screening would be of benefit to reducing the mortality of this disease.
Now, when you think about your mortality, and you think about, oh, do I go and get this test or that test? But who do you think should be the first people in line to consider something like this?
Well, the studies have shown us that the patients that benefit the most are those that are between the ages of 55 and 74 and who have smoked for 30 pack years.
Now, what does your screening consist of? Like, take me through the process.
Well, the patient can be referred, if they meet those criteria that I stated, through their primary care physician, or they can be a self-referral. If the patient is a self-referral, we will screen them for the appropriateness. And then once the patient is put in place to be screened, they will simply come and get the low-dose CT scan, and it really only takes a few minutes to get the test.
Now, people are afraid of tests. They don't like needles. They don't like going to hospitals. They don't, they just
Right.
They don't like the doctor.
Right.
I mean, I like you. I mean, but but like, what do you say to patients? Is it a scary test?
It's not a scary test. I think most patients have had some sort of radiograph imaging, and so it really involves a very short period of time lying on a table, and before they know it, it'll be over.
And is this one of those enclosed issues?
It's partially enclosed.
Partially enclosed.
But again, it's only a matter of seconds, and so it's a pretty short test.
And private insurance, many they don't cover it, but you guys have a way around that.
We do. The private insurance, as of this time, does not cover the scan. We hope in the future it will, because we think there's a utility to this type of screening. As of now, we're offering the CT scan for $99, and the patient can pay that fee and get this CT scan at that relatively low cost.
That is a very low cost. So, Dr. Frenia, thanks so much for coming in.
Thank you.
Today at the morning edition. And, screenings can be scheduled by calling St. Peter's, and the phone number is 732-339-7747, and that's between the hours of 8:30 a.m. and 4:30. That's Monday through Friday.